Good morning, everyone. This is Sandy Marrero with Western Marketing, and we have some great news today for you. We have an exciting product that we are launching today. With us, we have America's Choice Career Benefits product that is going to be launched with Stephen Tucker, which is the CEO of the company, Crystal Orozco, the account executive of Amanda. Uh, Also with us is Amanda, which is going to be also joining us as well, Bittenbender. We're going to talk about the product, how it's utilized on these times of open enrollment, and it's a very great, exciting product from us. Amanda, would you like to take over and do some introductions? You guys want to introduce yourself before you start?
Yes, of course. Can you hear me?
Yep, go ahead.
Yes, perfect. Well, welcome everybody. We're excited to have you. Thank you for letting us do some training on the America's Choice products. We're going to do a little brief overview and kind of go over the products, and then we will also show you how to enroll a client, enroll a member, the steps that will be taken. So we'll split this into two parts, and to begin today's webinar, we are going to have Stephen Tucker. He is the co-founder of America's Choice, kick it off with some of the background of America's Choice, as well as go over the products too. So Steve, we're all yours.
Well, good morning, everyone, wherever you are. I always enjoy the miracle of being able to communicate to so many people at one time. I just take it for granted that everyone is a pro, that you're pretty familiar with health insurance. But I think the key to the success of what we do today is that each of you take written notes on any questions you have. Because if it's a question you have, your confidence in representing these plans and solving your clients' concerns, we take all of those, get them over to Sandy. He will get them to us, and then we can get you answers. We hope that at the end of this, I guess 1 hour that is scheduled, that we'll have 5 to 10 minutes, maybe more, maybe less, to answer those questions live. And Sandy, I'll let you figure out how you'd like to do that.
Absolutely.
But what I am doing today is a technical review of the product. So it has nothing to do with the sales methodologies, etc. And I'll start by saying that our product was specifically designed for people who do not qualify for Medicare, the Affordable Care Act, Veterans Administrative Benefits, and are not covered under their employer plan if they are employed, right? So if you qualify under governmental assistance, probably a good idea to take it. But in the case of the Affordable Care Act, ACA, open enrollment, when people do not qualify for a subsidy, then you have to break it into two parts. One of them is they have to pay their own rates, but they're very sick. You want to push them back into the ACA. But if they do not get a subsidy and they're reasonably healthy, this is where you want to place them for two reasons: better coverage, better rates. The product is underwritten by Granular Insurance. They're A-rated carrier. Their actual rating is A-. They are owned, the carrier is owned by the Google companies. So you have a high-tech global leader purchasing an insurance carrier to do the kind of things we do. We combine a massive wellness platform over here with an A-rated insurance program over here, and we mix them into a very friendly, usable plan. I'm going to show you two plans. The one on the screen is the most budget, cost, price sensitive plan that we offer. And it has a few things that box it in. The other plan that we'll show you shortly is a traditional $2,500 deductible, full coverage medical plan. But we also have HSAs and a wide variety of deductibles. So starting with this plan, if you'll notice on the right side, it says annual $500,000. In this specific plan, you have a $500,000 limit per person per year. So when it says per person, that means everyone in the family has the full 500,000. And each person has their own lifetime limit of 2.5 million. The section below where you see zero deductible, these plans were designed with zero deductibles. They're designed with copays. And the copays allow your clients to use that plan easily, without stress, and access the medical care they need. Amanda, can you scroll down a little bit?
Yes.
So a typical area where we start is all of the things that are copaid that are kind of like daily things. General practitioners, internists, pediatrics, OBGYN, physician's assistants, nurse practitioners, all the way down to, for example, chiropractic and urgent care visits. So you have all these urgent care centers. All of those carry a $50 copay. Telemedicine is unlimited, but behavior health via teleconnection has a copay for each visit, but there's no limit. And dermatology, which I just used, I had poison ivy, so I took a picture of my arm with my camera. I sent that picture and I didn't know what it was, and then they told me it was poison ivy. The next section down is preventative services. Behind these titles are all 64 benefits. And those 64 benefits, many of you may hear about them, and you hear them under minimum essential coverage. That is mandated by the Affordable Care Act, and all 64 items are covered 100%, no copay, no maximum. So by law, you have these huge wellness benefits, and it's all types of things. They're available in a separate list. It'll be clicked to in your site. But what you see here, for example, a colonoscopy, 100% covered. Mammogram, these are covered under the guidelines of the Affordable Care Act. But again, so far, we start at the top. People can use this plan. They have no big out-of-pocket risk. Keep going down. This is important to understand that this is a network plan, and in the network, it is 100% covered after your copay. If you go out of the network, you decide to go to a doctor who's not in PHCS. PHCS has about 1 million total providers, somewhere in that range. If you go there, you make your copay, or if it's a MEC benefit, you have no copay, the whole bill gets paid. Because those providers have agreed to a specific price, and that's what they get paid. If you go outside the network, and occasionally people do, we're going to pay an average of what we would have paid, but your provider may charge you more. I think everyone's familiar with the concept of the networks. I just wanted to be clear about the difference. We will pay out of network, but we're not paying it at 100% of what the doctor bills. We're paying 100% of what the plan normally pays. Scroll down a little further. And now you start getting into things that are really very rich benefits. I want you to look at diagnostic testing with us for a second. This covers all the standard diagnostics, labs, x-rays, etc. But if you notice, it says $50 copay per visit. So when you go to a lab, they may have to do 2 blood tests, 3 blood tests, 4 blood tests, and an x-ray. They pay the copay once and the bill is paid. If you're not going to a PHCS diagnostic testing center, you will get a bill and then we will reimburse you what we would have paid in our network. So the PHCS network is the first key to your plan. But if you look at things like MRIs and CAT scans and PET scans, each member has the same thing, 3 visits per year, and they have a copay of $250. And then when you go into the surgical, same thing. Copays, easy. Everybody can come out of pocket $50 for a test. Now, when you go to the emergency room, you see that it has 2 visit limits, 2 for accident and 2 for sickness. But if you remember up top when we started, urgent care was there, and that was a $50 copay. So if someone goes to the urgent care because they think they're sick, they pay $50. If they go to the emergency room at the hospital, they pay $250. We want to keep them going where they need to be, but the emergency room bills are very expensive. So $250 copay is probably the lowest I've seen anywhere. I haven't seen anything lower. And in most plans, like our metal plans, emergency room, you have to meet your deductible. Now you have your ground ambulance. There's no copay because it's covered at 100% twice per year per person. And Amanda, let's keep going. I want to pick up the pace a little bit. This is the core of the plan. We cover people in the hospital twice a year. They have a $1,000 copay. After they make their $1,000 copay, if they're in our pre-certed hospitals, we pay 100% of the bill. Intensive care is the same, and inpatient surgery, the same thing. If you'll go down a little further, we look at maternity. The first thing I want you to look at is dependent children. We do not pay for maternity for children. So this maternity applies to one of the primary members, the primary or the spouse. But look how easy it works. If you have a normal delivery, copay is $250. If you require a C-section, the copay is only $500. And right below that, it says 100% coverage for maternity services. This plan continues to have exceptional benefits with copays. Mental health. If you're in the hospital for mental health, $250 one time. Covers you 10 days. You can do it twice a year. Now we talk about cancer, chemotherapy, radiation. When you go, your copay's $100. And then you get down to substance abuse, different from mental health, and you have hospital copay and you have outpatient copays. I think we'll keep on scrolling and then we'll go through some of the more details. You're going to have this brochure. These are things that are in major medical plans. And in our plan, it's very clear. $50 copays, and on certain things like hospice and home health care and skilled nursing, you have annual limits on those type of features. Remember, this is a maximum annual limit of $500,000, but you have a copay for everything. Those are the key things about this plan. If we go down a little further, now we're going to get to the pharmacy. The pharmacy in this plan is generic, but the copay is 0. So if you need meds, you can get them for 30 days or you can get 90-day mail orders. You pay 0 for the generic formulary this plan offers. This is a extremely affordable plan. Amanda, are the rates visible?
Yes, yep.
You can cover an entire family for $929 a month. And you can cover a male and female, husband and wife, for $679. And you can cover a single grown-up with as many children as they have for $629. When someone looks at the ACA and they do not qualify for a subsidy, this can be about half the price of what the ACA would charge them. It does have a maximum annual limit. It does have some internal limits, but with copays, this plan, about 70% of the people who are doing ACA sell this plan first. But let's jump over to an unlimited coverage plan with no lifetime caps, no annual caps. This is your traditional major health coverage. So in this choice, you have a $2,500 deductible. I think from what I hear across thousands of agents, most people today are selling $5,000 deductibles, which we have. Their price is a little lower and everybody loves them. We just chose to show you a $2,500 deductible. And the way this plan works is that deductible is only up to 2 people. That's why it says $2,500 and per family unit is $5,000. And if you go out of network, your deductible doubles and so does your family unit risk. If you're in the network, your maximum out of pocket for a person is $7,350. Let's go very slow. I think most of you know this, but I want to go very slow. If you end up with your deductible, your copays, and your coinsurance, when that hits $7,350 for the rest of the year, you pay 0. So if someone has a $2 million claim, after they pay $7,350, we pay the whole thing, no limits. So these plans, unlike the exchange plans, have a gigantic list of copays, and they're right down below. So as you could see, copays for most everything, but there's no limits now. You can go to a doctor 100 times a year. When you meet your deductible, you're on coinsurance, but when you have a copay, that's all you pay. That's all you pay. These plans are priced below the market, but they are higher than the maximum annual cap plans, but they have unlimited coverage. So if we scroll through, again, here's the wellness section. It works the same way in either set of plans. There are 64 benefits. There are no copays, and you do not have to reach your deductible. And again, you can see them. The annual physical for an adult, the well child care, all these benefits, 100% covered. I want to stop here and explain the word allowable. Probably a few of you were thinking about wondering, what is the allowable? When you're in the network, we pay 100% of what that network has contracted us to pay. So it's 100% of the bill. If you're out of network, it's 100% of what we normally pay. No matter how big the bill is, we know what we would have paid, but you chose to go out of the network. We're going to pay what we would have paid. You're going to have a balance. And this is in all plans, Aetna, Cigna, United, even Humana. When you leave the network, you have a consequence of paying portion of that bill yourself. In the network, all good. The other thing that it would mean is the plan has to allow the process. So I'll give you two examples of things that are not allowable, but it's not about the money. Now it means they're just not allowed. One of them is elective plastic surgery. So when someone buys this plan, you need to know, like every other market, if they want to go out and get a facelift, or they want to get their eyes done, or women want to have augmentation, that's not covered by their health insurance. However, they can call us and we will try to get them the network prices. So that's something that is not covered. But if someone had an illness or an accident and they needed to look the same after the surgery, like a mastectomy, if a woman had a breast mastectomy, or a man because of breast cancer, then rebuilding that area with plastic surgery is covered. So elective plastic surgery is not covered. Another thing that you should know is when someone is committing a felony like DUI, if you have a DUI, all the health insurance in the United States does not cover health insurance costs if you are committing a felony. That's normal. Just thought I'd mention it. But a couple things about our plan that are very interesting is the pre-cert process. And that really makes this company amazing. I'll get into it in a minute. But please note, if you have any questions on plan allowable, to get them over to Sandy so we can answer them specifically. Amanda, if you'll scroll down, we can look at the next section, but go right past it because we already covered it on the other document. If you'll notice here, lab x-ray, these are not copays. These are meet your deductible, then we pay 80%, then you reach your co-insurance, then we pay 100%. Also, if you go to the next section, you have urgent care. That was covered up top under a copay. But emergency room is covered after deductible. Again, below, hospital, after your deductible. Room and board for maternity and all the other maternity, after the deductible. But there's no limits and there's no caps. Once you meet your max, 100%. The other plan, we will not pay more than $500,000 per person per year. About 70% of the people are buying the first plan I showed you, and about 30% are buying this plan. Some agents only sell this type of plan. They'll have the $1,000 deductible, $2,500, $5,000, and that's your choice. But I wanted you to understand how they work. If we'll go down, this plan has a different pharmacy. And we can bypass this because you'll be able to read it. But if you'll stop, Amanda, can you go back up a little bit to chiropractic? Even this plan covers chiropractics, and they're on copays, speech therapy, cardiac therapy, and chiro. So really nice benefit to have. Hospitalization, mental health, all after deductible. So where it doesn't say copay, you can assume there's a deductible. And let's see if we can get down to the pharmacy. Okay, so keep going a little bit more. Now in this plan, this is what many of you are used to seeing. It's what you think of. Your generics have a $10 copay. Your brands are $45, and your non-preferred, those are the more expensive brand name drugs, are $85. You do save money if you get it mailed to your house. So this is that traditional drug card, but you notice there's no separate deductible. You do not have an additional separate deductible. So the minute you get this plan, you can go to the doctors you need, you can get some of the other things you need, and you can get the drugs you need without touching your deductible. So I think that wraps up this plan. And let me see what time it is. I think we have 5 minutes for benefit questions, and then we can go over to Amanda and let her go through there. So Sandy, how would you like to open this up so your top performers can get a chance to talk about things that are important to them?
I like to open. I have quite a bit of people in the platform, so if I open it up, it will definitely not be conducive.
Okay.
I have the questions online,
Well,
and I can ask the question, and you can
yes,
answer them.
yes,
Would that be okay? So
great.
first questions is from Tim Cannon. He has 3 questions actually. Does mental and nervous inpatient could count towards the 2 annual inpatient benefits?
On this
Or
plan, no. On the other plan, they are separate benefits. So you can have a hospitalization for a surgery and an inpatient mental. They do not count the same. They are 1 plus 2.
and then if a person reaches their MOOP, would the office visit be covered?
They're maxed out of pocket. Would
Correct.
the
Maximum out of pocket.
office visits be covered
Mhm.
past the 10 listed?
Past the 10 listed. Okay. And then Sam has a question on an indemnity plan. You're only allowed to get 1 test per day. Is this major med or indemnity? And of course, you answer both questions with the 2 explanation of the 2 coverage, but go ahead.
So on the original first plan we reviewed, it's really not an indemnity plan, and it is not a major med with no limit. When it says per visit on the testing, it is 1 copay for the actual visit, and during the visit, they can do 1 thing, 2 things, 3 things. It only counts for 1 visit. So that's the answer here. And it is not an indemnity plan, and it's not a major med.
So it's
It's
considered like a MEC plan, a hyper MEC plan.
It's called the maximum annual cap. In other words, it's a $500,000 cap, and the subjective items that have limitations are very clearly listed.
Okay.
But unlike our other plans, this plan could not be on exchange. Our other plans could, they are not, but they could. This plan is specifically toward people who need a health plan. Your option as an agent is to find them a plan. If they do not get a subsidy and they cannot afford the Affordable Care Act rates, where will you put them? You can put them in a short-term medical, but those disappear in January. You can put them in a limited medical, but the coverage is really usually very low. Or you can put them here, where the rates are great and the coverage is rich. There are copays. They can use the benefits.
Albert Sosa, what do we select for coverage type? Several to choose from. But
I don't know if I understand that question, but I think I do. So we have 3 HSA plans with 3 different deductibles. We have 6 metal plans plus a high deductible plan, and then we have 3 of these plans. This one has a $500,000. The one below it has 250,000, and the one below that has only 100,000. but the rate on that is like 600 for the whole family. So what your job is to look through the plans a little bit. We can't recommend what plan you sell, but typically I see people pick 2 of these, the lowest and the highest. Then they pick 1 HSA,
Mhm.
and then they pick a high deductible and a low deductible. So they have a total of about 6 plans that they get comfortable with. And when they talk to their customer, they know where to put them.
Thank you very much, Stephen. This question is from Carol May. Can we get a recording and slides of this webinar? Absolutely, yes. We will be
Yes.
recording it and sending you a copy of it. And then also, let me see if I have last question here. Does mental and nervous inpatient count towards the 2 annual inpatient benefits?
That was a question someone else asked. They are separate benefits.
Yep. All right. I believe that ends all the questions. Keep in mind that we will give you access to the brochures, the copy of the recording, and any other questions that you may have. Please don't hesitate to give us a call, send us an email, and we'll be answering those questions as soon as possible so you guys are feeling comfortable. Remember, this is a very exciting product that is brought to you during an open enrollment for you to take advantage of to have another tool on your arsenal to talk to people. Anything else to add, Stephen?
2 things really quick. Send all your questions to Sandy. Sandy will get them to us. But it is the medical questions that are so easy to answer, but that is the separation. If you answer them correctly, you get covered. If you don't answer them correctly, there's no coverage. So it's yes or no. The medical questions are critical. They're easy, but they're the most important part of this application. The coverage is fantastic. We accept all your business. We will support you. We will answer your questions, and we will work hard for your customers to make them happy. And Sandy, on behalf of WMA and all the people there, we want to work hard for you. We appreciate you, and have a great day. I'm going to let Amanda take over.
Thank you, Amanda. Well, go ahead, Amanda. Go ahead. Thank you, Stephen. Go ahead, Amanda.
Sure. So the next part of the demo here, I'm going to go ahead and I'm going to show you guys how you get signed up and how you enroll a client, as well go over some of, like Stephen said, questions. How do we know that this product is correct for your client, and how do we know that they would fit into this product? So first thing I'm going to do is just kind of touch on really quick here. These are the 11 knockout questions. And we will make sure you guys have these. You can go through these with the client before even going through the whole enrollment. But in order for your client to be able to fall into one of our products, them and any of their dependents who are going to enroll in the plan need to be walked through these questions, and they have to be asked them, okay? So again, applies to any person applying for coverage, including their dependents. So we'll make sure you guys have these. For example, you walk through them, have you or any of your dependents applying for coverage, been under the care of a doctor, and so forth. If they answer no, you keep going, okay? If your client answers yes to any of these questions, you do not need to submit an application on them. You do not need to enroll them. They are 11 knockout questions. So if they answer no, they have not had or have any of these conditions or diseases or pregnant or anything like that currently, and all 11 are listed here, then you can enroll your client. And so we'll walk through that. So these are knockout questions. They answer no, you continue on to the application. If they answer yes, you do not need to submit that application because they would not be approved. So let's walk through the enrollment portion. So each individual each of you as an agent are going to have a back-end platform, and this is what your back-end platform will look like once you are enrolled. What's kind of nice about this is you're going to have a member section, which are your clients. Members and clients are the same thing. This is a housing area for them, so basically a CRM, and you can view your members. You can see when they enrolled, a little bit of information, what plan they're enrolled, so if they have any questions for you, they are housed under the member section. There is an agent group section where you can see any agents in your downline. There's also a billing section and a commission if you'd like to view your commissions based on the plans that you write. The most important thing I would say in this back end, most people are probably going to say, you know, what's my commission? But the big thing here is your enrollment website. So at the end of your website is your 6-digit writing ID number. And when you click that, it's going to take you to your enrollment page. And up top, it will have your name, it will have your company, phone number, email, all up there in agent sign up, and all of the plans listed on this page, okay? And so for this, let's say, you know, you're kind of talking with a client, you're trying to figure out which plan is the best here. And let's say I want to enroll them in that 2,500, but I need to know a little bit more information on the plan. What I'll do is I'll click on the info tab, and under that info tab is going to be more information on the plan. You can kind of get some highlight information. You also have access to every brochure, kind of what we just showed you with Stephen. So all the brochures are listed here. And then also there is a provider search. So the networks that our plans are currently are in is the PHCS RBP network. And so really using this provider search, you can click on it and it will take you to the provider search up top here, and walking through the steps. All the instructions are listed here to see, is your client's doctor, or if they see a certain specialist or a hospital, are they in network? Okay, wanting to really make sure, hone in on that, doing that search beforehand to help smooth that client coming into the plan can all be found underneath the information tab. The second thing we'd like to touch on is pricing. So as you saw on our brochures on the 500 annual max plan, that is pricing is based on the tiers. So that employee only, employee spouse, okay? For all of our metal plans, the 500 through the 7350 plan, these are based on age tiers. So our plans do not collect height, weight, height or weight, and they don't ask or take into account for smoking, but what they do take into account for the pricing is the age. So with that, we have 3 age bands. The first age band is 18 through 44. The second age band of rates is 45 through 54. And our third age band is 55 through all the way through age 62. So with this, you can enroll clients from 18 through age 62. So let me be clear on that. They can enroll when they're 62 and a half, when they're 62 and 11 months, before their 63rd birthday. Okay, so you can enroll a client before their 63rd birthday, but let's say you enroll a client today and they're 60, they can stay on the plan till they're 65 Medicare age eligible. Okay, and then dependents can stay on the plan till age 26. So if I'm looking for some information, I want to see the pricing. Let's say I'm 22 or the client's 22, you can view the costs and you can see the breakdown of this plan based on the tier. Okay, but let's see, so we see that, you know, it's 688, but let's say that the client is 60. Okay, let's view the costs for that. You can see different age band, different rate there. So you can do that calculation, finding out the client's age, okay, for the plan. So the second thing here, or the last part, is let's say you're enrolling a family and one spouse is in one age bracket and one spouse is in a different age bracket. Our plans are really based on those small business owners, 1099 individuals. So whoever is the business owner, the rates are based on the business owner's age. So if that's the husband and he's age 60, you would view the costs based on that, even if his spouse is younger. So whoever is that business owner is who you're rating on. And then lastly, the states we sell in. We sell in all but 6 states. So California, Hawaii, New Hampshire, Oregon, Vermont, and Washington are the 6 states we do not sell in, and we also don't sell in territories. But you can see all of the states that we do sell all of our 13 products in are listed here. Okay, yes, New York is one of those states. We get that question a lot. But you can view all of that there. So let's say you're ready to enroll this client. Okay, you're going to hit the purple enroll button, and it's going to take you to the cart. Let's just get rid of one of those. And let's say I'm ready here. We have a birth date up top already, okay? And I'm gonna choose their active date or effective date. We take enrollments up to 75 days out, okay? So you can see you can start enrolling for 1/1. I would say about in the next hour or so, 11/1 is gonna be gone. So you'll have the option for a 12/1 or 1/1 listed here, okay? And once, let's say I was going to go for a December 1st effective date, okay? How our active dates work is up until the 23rd of the month, you can enroll clients for 7 days later. So the 23rd was yesterday, and that's our cutoff for November 1st enrollments, all right? So now today we're enrolling for December 1st or January 1st. So up until the 23rd of the month, you can enroll for clients for 7 days later, or you can choose an active date further out, the December 1st or the January 1st dates there. The key here is whatever active date you choose, let's say December or January, at time of checkout, their first payment is going to be taken. Super, super important to make a note of that is when you go through that enrollment with that client, their first month's premium is going to come out. So let's say I'm enrolling a client for December 1st. The premium would come out today, and their next payment would come out the 20th of December. So it comes out the 20th of the month they go active, and then it reoccurs every 20th of the month, okay? And then from here, you can also choose, again, the coverage. And once you have their date of birth in, when they'd like their policy to go active, and the type of coverage, you're gonna click the update button. You'll see the pricing is already there, and then you'll hit the blue continue button. What will happen here is you will go through the application. So this is the application section. We can verify effective date again, the plan on the right-hand side, and then we put their demographic information in. So address, name, you can verify their address is correct, contact information, and then social security, date of birth, and then the gender at birth for the individual. And then going through those 11 knockout questions. Okay, so again, repeating that if they answer no, you keep going. If they answer yes, you do not need to submit the application at this point. So you'll walk your client through this, and through those 11 questions, answer them truthfully and honestly to the best of your knowledge with that individual. You can, if they have a company name and let's say their business name and they'd like their business name to be inputted, you can go ahead and put that business name there. Payment. So we take 2 forms of payment. We take credit card with Visa and MasterCard, or we take ACH bank draft. With the credit card, there is a 3% technology fee on there that they would be charged on top of their premium each month, or ACH does not have any charges. So if you can push them into having that ACH bank draft, that would, save your clients a little bit of money. If they need to do credit card, there is a 3% charge. We have requested a disclaimer be put here to help agents remember when they're walking through the enrollment to make their client know about it. little authorization for you to check mark, and then comes the signature section. So what will happen is, and this error won't be here, it's just because it's a test site. For the signature section, what's going to happen is you are going to send a link to your client. There will be a section where you'll put in their email or their phone number. Super important here. You put one or the other. So either their email or their phone number. Okay, you don't want to put both. And you'll put their phone number and send the link. And at that point, what happens is the individual receives a link texted to them, and they'll click on the link and they'll walk through the sections that they need to sign. What's super important is when you send that link out to them, you only push the send button once, okay? Depending on, for example, if they have a certain cell phone carrier, it might take a minute or two for that link to come to them. Email, same thing, depending on what email they have, might take a minute or two for them to come. If you just keep pressing the send button, it's going to terminate the first link. They're going to walk through it, and then it will say that, hey, this is terminated, we can't move on. So just trying to have them send it once, and once it is sent, just kind of being patient. I know that small talk can be hard at times, but making some small talk with them. What will happen again is it will come to either their text or their email. They can pull it up on their phone. They don't have to pull it up on a computer, and they will sign. There is also a agent signature initial portion that will be emailed to you as well. And once both parties have signed their portions and have finished, you'll come back and you'll hit the blue submit button. So what happens from there is once you submit that application, your client is going to receive a confirmation of transaction email stating that their transaction went through and so forth. And what will happen is the member will then show in your backend platform. So they will then show under your member section once the enrollment is complete there, okay? So they get that, they will get the email of transaction, and then they also will get, a few days later, they will feed over into our TPA, and their file will go over there. And from there, they will then receive a second email welcoming them to America's Choice. It will have the date that they officially are effective on. It will have the plan they are, and then some information below, which I'll go through in just a moment. The key here, kind of going back to when we were choosing the effective date, we only allow policies to go effective the first of the month. So it can't be the 15th, it can't be the 20th, it's the first of every month. So once they receive this email, there's a few portions here. We'll go over their personal health dashboard, which is a portal for them to utilize. They also will see here a note about their physical medical ID cards. Those take anywhere from 10 to 14 days after the application is submitted and approved to feed to them. And then a little bit more information just about plans. If they have questions about their plans, they can reach out to member services via email or via phone number here. So before I go into the personal health dashboard, I just want to kind of go over the timeline again for you guys. So you go into the enrollment site, okay, you enroll your client, they sign their links, you submit the application. At that time, there's no underwriting that needs to review the application, okay? You've answered the 11 questions. You submit it, they'll get that receipt of confirmation that the application has gone through. About 4 or 5 days later, they're gonna receive this email about welcome to America's Choice and have access to their personal health dashboard. And then from there, about 10 to 14 days after you submitted that application, their physical ID cards and welcome kit will come in the mail. So the last part of this is going to the dashboard. And why is the dashboard important? When we go to the dashboard, they are going to activate by demographics, social security or date of birth, or they will activate by email, putting their email address in there. So the reason it's important is within the dashboard is going to be where they can see their medical ID information, where they can see stuff about their welcome kit. They can do wellness activities as well and view all of their health information within there. So this is what a personal health dashboard looks like. So once they're logged in, and this loads for a moment, they will have access to various items pertaining their health or pertaining their benefits. One of the key components here is under My Benefits Tools. So when they go under My Benefits Tools, they will be able to see their member ID card. They'll be able to see information about maybe the TPA they have some, or about their claims. They also will have their telemedicine that they can utilize, and then they get additional benefits as well. They have the ability to schedule a wellness coaching call once a month from a registered nurse, so that's included. They also have the employee assistance program for, let's say, counseling if they'd like to use that. So they get additional benefits from the personal health dashboard outside of just housing their member ID card. But the My Benefits tool is very important. Some other tools within the dashboard that they can utilize is under assessments. So let's say they'd like to take a health risk assessment, a stress level, and so forth. They can do that under assessments. They have an area for all of their medical records to be housed, about them if they'd like to upload, if they'd like to see over time their tests or vital signs. They also have under Road to Wellness and Library, just ways to track, so they can track diet, nutrition, fitness, as well as under the health tracker, they can connect Fitbit, Garmin, and track anything as well regarding fitness and water and sleep and so forth. So this is what your member gets, okay? This comes, again, about a week after they enroll. They'll have access to their medical ID card under the medical ID card section. I would say 9 times out of 10 before they enroll, which is kind of nice. Maybe they need to update their medical ID card at the doctor's office or so forth, and maybe there's someone that likes to do that ahead of time, or needs to send it to certain places. So they do have access to this portal for all of that. So few last minute touches, there's things to recap on as we go back to our plans here. Let's go back to the enrollment. Again, we take enrollments from age 18 all the way up until the 63rd birthday, so they have to be under 63. Different tiers for different age bands. We do not collect or rate on height, weight, or smoking of the individual, and then dependents can stay on till their 26th birthday. And then again, recap on the enrollment. We take enrollments up to the 23rd of the month for the following month. So right now we're going to enroll for December all the way till November 23rd. We'll take enrollments for December 1st. After that, or if you'd like to push them to a January 1st, you can do that as well. So kind of doing a recap. And then the last section here would just be the agent sign up. When you, Sandy, I know you may have sent some signups out to everyone, or maybe a few people so far.
Mm-hmm.
But when you are ready or to sign up to sell America's Choice, you'll get that agent sign up link. And right now our password across the board for everybody is USA. And you'll come in here and you will sign up as an agent. So put your company or your full name, your demographic information and contact information. You'll put what you'd like your username and password to be to log into the backend portal. Again, you'll put Social Security, or if you have a tax ID for your business, your national producer number as well. Add your license, maybe a resident license here, and then your signature and submitting it. Last part for me to touch on is the license section. You can add licenses here, okay, if you'd like, or let's say you have multiple licenses in non-residential states along with your resident, and you want to add them afterwards. The key here is if you, when you add your licenses, your products will show up on this page. If you do not add your licenses, either when you sign up or in the back-end platform, your products will not show up on your platform until doing so. You will not be able to sell a product in a state that you have not uploaded a license for. So I suggest that you add your resident and a couple non-resident. You can do that in the beginning and continuously add. Let's say you're an agent that's registered in every state to sell, and you just need a little bit more time. Where you would do that is under your agent group tree. If you need to add them later on, you will click on the little blue eye, which would take you to your back end. You can see the products here, and you would come down here, add your license, the state that it's health, license number. You can add when it expires or goes inactive if you would like, and save that information, and then it would allow you to sell in that state. So a couple different ways. The key here is adding those.
I apologize, Amanda. Just a caveat. Notice that you just have to put the license in there. It doesn't. Do they have to upload it or just add the expiration date on that?
They do not have to upload it. No, they can just choose the state that it's health, put the license number, and then it's optional if they would like to add any additional information afterwards.
Great. Just to make you aware of that, guys. So just in case. Thank you, Amanda. Go ahead.
Sure. Yeah, we get a lot of questions regarding the license and why are my products not showing. So just adding your licenses in there will help. And then the last part is when you do submit this information, it will generate on our side, and you will be sent an email that will give you your username and your password. And there is a disclaimer in that email. It takes about 2 or 3 days for your account to go active. Once your account is active, you will receive an email that says, congratulations, your account is now active. You can go into your back end and see your back end, see your enrollment page, add those licenses, and so forth. So just wanting to share that as well. That is, I know that was a lot of information about enrollments and the plans and how you get signed up. We do have a couple minutes. Does anyone have additional questions that they would like to ask?
One of the questions that they asked was why is not the name of the company on the brochure of the company that handles? You have American Choice, but the company that Stephen mentioned is the main carrier.
So can I take that question, Amanda?
Yeah, are you speaking about Detago, or I'll let you take it, Steve.
Sure.
Go ahead.
So America's Choice are the plans.
Mm-hmm.
The administration of those plans, the insurance carrier, the network, the pharmacy are all part of America's Choice. And these are brochures that we've been using for quite some time, 10 plus years. America's Choice logo was added, I think when we designed and launched these plans was like over a year ago. But it's the same set of plans that have been in the market for 10 years. There's about 11,000 employer groups and tens of thousands of covered people. The plan is growing very quickly, and the brand is America's Choice. So all of the information about all of the components are inside the brochures, but it would be impossible to explain to your customers. It's America's Choice, it uses a TPA, it has a carrier, it has a pharmacy, but all plans do. Even United Healthcare, their pharmacy is Optum. Then they have their claims paying partners. So in the industry, it's become common practice to use the single brand that covers the plans. It's only that reason, nothing else.
Thank you very much, Stephen. That's a very good explanation of that. So appreciate it. Outside of that, I'll send you an email with the information of the other 3 questions that I had here, but that should be it for now. Just to make everyone know that we will be sending you guys a contracting link. If you follow the process and add your license at the beginning, then you don't have to go back and try to add those inside your back office, okay? with that, if you do you have anything else to add, Stephen or Amanda?
Yeah,
Thank you very much for such a wonderful explanation. Appreciate it.
So just one last comment. These plans are running across the country. You need to have them in your portfolio. Customers need real coverage, and they need to be able to get something that's affordable. But remember, if you can get them in Medicaid or in Medicare or in the Veterans Administration, if someone was in the military, they can get free insurance. If they qualify for the Affordable Care Act subsidy, put them there. But if they have to pay for their own insurance, there are no finer plans available. Your customers will give you referrals. You can sell this plan to your next door neighbor, to your brothers and sisters and family members, and be very proud of what it is. It's a lot of information. It sounds complicated. It's really simple. The application takes 10 minutes.
Yep.
You submit it, they sign it, it comes back, they get their confirmation, they get a welcome email, and then they're going to have our arms wrapped all around them, taking care of them for many years to come. So make a lot of money with us. We hope all of you have a fantastic fourth quarter. And thank you all at Western Marketing.
Thank you very much, Stephen, and thank you, Amanda, for joining us today, and also Crystal as well. Like Stephen said, there's a lot of things that you can do. This also is a product that you can actually use as an agent that have to do taxes on a yearly basis, and you are tired of not qualifying for the subsidies and stuff like that. This is a perfect product for an agent and an agency owner as well. Go ahead, Stephen.
Last item, and I don't believe I forgot it, but I did. You can sell this plan 365 days a year. It is not limited to the OEP. You do not need a special event. It's year round, every day. When you need a good health solution for your customer, and they're the most important person, they're not on this call, but they are the most important people, you can feel confident every day of the year when you offer this product, and we thank you.
Thank you very much. And with that, I would like to end this portion of the conversation. I'm pretty sure that we're going to do something like this again in the near future, right, Stephen? And keep the conversation going. Like I said before, get online, get contracted. Contracting is fairly easy. Start talking to your customers, and let's make money together and have a wonderful AEP. Have a blessed day. Thank you very much, everyone.
Thank you. Bye-bye.
Bye.